Hello, and welcome to the Graphic Medicine Podcast Monthly Wrap-Up. We are a podcast dedicated to discussing comics and how they interact with issues of health, illness, disability, and caregiving. I am your co-host, Alex Thomas.
And I am your co-host, MK Serwick. Alex, I thought this month, rather than our normal fun chit-chat, we could talk a little bit about a super cool conference that we both attended. We were both invited guests with Matteo Farinella, Caroline Hugh, and Christine Guianco of the Case of the Human conference at the University of Chicago. Do you want to describe or try to describe this conference, Alex?
Yes. I will try to describe it because I think even in the weeks before, I was still not exactly sure what this conference was going to entail. But I think now that we've gone through it, it was amazing, and I'm glad we're able to share it and talk about it today. So yes, the Case of the Human. So the name of the conference was the Case of the Human: Medicine, Humanities, and the Boundaries of Knowledge. And this was a conference that was organized by several researchers, including Brian Callender at the University of Chicago. There were multiple parts to this project, and I think the first part was a group of these scholars in health humanities and anthropology and a lot of other fields that to think about like medical cases and cases in general and the case study and how that can be a vehicle for discourse, let's say. And so I think they had an initial conference where they were thinking of different cases that were representing these different types of aspects of this, case of the human. And then this conference was kind of the second part of it, where they had cartoonists try to create some type of living comic out of some of the cases that were brought up. And this was all kind of like adding graphic medicine to this, already robust project. That's kind of my best explanation. So yes, it was hosted by the Neubauer Collegium of Culture and Society. And we basically, the four artists were teamed up with various experts from these different fields to create these collaborative comics based on these very unique case studies. So I think we could talk about the case studies we worked on because they're all so unique and kind of and show kind of how that was a reflection of how this project was showing the spectrum of how cases can kind of explain different parts of, human relationships, really. So one of the comics that I worked on was a case by Dr. Mirko Paschini from the University of Gothenburg. And he is an anthropologist who was fascinatingly embedded in a emergency room where he was basically doing ethnographic research on basically aspects of like the healthcare interactions from all sides, from patients, people checking the patient in, the doctors, the nurses, everything. And so he had extensive notes and wrote a case about this one patient who was dealing with a chronic pain issue, and how there was kind of confusion and disagreement about where the pain was coming from and how best to treat it, both from the patient and the team. And so we decided to use the case that he wrote up, that was part of a book he wrote about this, and to make this comic about it. The really cool thing that we discovered from this project was that his field notes, were a way an aspect of the comic of the story that couldn't be told in the case study as it was written, but could be told in the drawn comic. So, for example, he was basically observing this clinical interaction. This was a patient coming in for pain, and the question was, were they, having pain from an actual injury, or were they having some kind of need for pain medication due to kind of being dependent on like an opioid, basically? And so he documented exactly the interactions of everyone involved, in terms of what they actually said and the timing and the process of everything, and then also interviewed them in real time, asking them, "Oh, why did you do this? What was you thinking when you said this?" So then he also had like their thought process in terms of why they made the decisions they made. And then he had another layer of information where he actually got to interview them about like, what were you really thinking when you said this? And so there were like three levels of interaction. There was like the speech, the like practical thinking of like the decision making part of it, and then there were like the deep thoughts that was like deep seated, like what was going on. And so it was fascinating. And so in this comic, we basically created like a third type of word bubble that reflected that type of like deep inner thought.
Interesting.
And so anyway, it led for a really interesting like 4-page comic, and it was so well formed in terms of his written case that like by the end of our like 2 days of like 3 hour or two, like 1.5 hour collaborations, we had enough to like make like a comic. And so I'm working on the final version now, and I'll drop in like a page here. But anyway, it was a really cool experience, and it was great working with him, and it was very collaborative. So he also was like throughout the process was making suggestions on, oh, actually, what if you did this? What if you move this here? She actually said it in this way, and her expression was more like this, and so it felt like really collaborative, and the end result was something very unique that I think was really surprising. I had no idea it was going to end up that way.
Mm,
So yeah,
wow.
why don't you tell me about one of your cases?
Sure, sure. I too can share some of the art. I'm just finishing up on this, but one of the ones I did, I worked with Ursula Francis, who is a classics scholar and a current fellow of the McLean Center for Clinical Medical Ethics at the University of Chicago. And the case that she presented us with was about Ovid, and his time in exile. After he was exiled, of course, he was like lauded for the Metamorphosis, but then exiled because he wrote this like kind of raunchy, kind of sexy book after that. And Augustus had just at that same time been creating a moral code of purity for the people. And so Augustus sent Ovid into exile. And of course, there was like the way she told the story, she was so steeped in it, knew it so well. It was like all like, one of the reasons that Ovid had written that was almost like as a clapback because there's some thought that perhaps Ovid had come to understand that Augustus himself was having like an inappropriate affair. This is me just like kind of turning the whole story into a soap opera in my head, but you can imagine how fun this would be to make into comics. But what was really, really interesting of that, aside from her just sharing this and her mastery of knowing the text and the language, because it was her PhD dissertation, was that and obviously it was so appealing for drawing. But what was really, really interesting was that we ended up in conversation about her work in this area. And then this pivot to being at the McLean Center was that we ended up creating these dual narratives that perfectly paralleled between Ovid being sent into exile and the process of being diagnosed with a terminal illness, or what Susan Sontag calls the kingdom of the ill, right? Giving your password to the kingdom of the
Uh-huh.
ill. And it was so fascinating, and that was nowhere near as linear as it sounds in a process, but also nowhere near what anyone, especially Ursula, expected to come of this, like to help bridge this like thing in her career of like, you did this and here you are doing this now, and look at the interesting parallels, right?
Yeah, yeah.
And we also had a facilitator in doing this work, and ours was Scott Stonington from the University of Michigan, and he had like so many wonderful skills that really helped bring this along, from his work as a physician, a medical anthropologist, and also like some things he kept quoting about how they work at the Iowa Writing Workshop, right? So that was a
Hmm.
really neat person to have. But anyway, one of my favorite parts of this experience, and I get the idea because I saw some of the art you created, was that by the end of the session, folks who had sort of been looking at us as like the artists and as if we are sort of an other and they are text based, had picked up colored pencils, scissors, pens, markers, and were working on the art with us. And that part just like thrilled me to no end.
Yeah, yeah. So yeah, and that's kind of like the second one I worked on was very collaborative in that sense as well. So for that one, it was a bigger team. So this one was a case written by the gynecology oncology team at the University of Chicago. Their oncologist was Nita Karnik Lee, and their team basically had um, many interviews with patients who went through the process of diagnosis and treatment of ovarian cancer, and so they made kind of like a emblematic case of that experience and a lot of the nuances that really you don't think about as someone who's not gone through it. Specifically, like how the treatment itself is like really rocky, kind of difficult course, and then when it's over, even when it's like quote unquote successful, afterwards, patients are oftentimes left with this like ambivalent, empty feeling of like, okay, I had all this support and now I'm okay, I guess, but now my support is gone and my life is different. I'm not the same as I was before diagnosis. And so they had, and this is all based on firsthand interviews that they did extensively. So for this project, we made a very collaborative comic where we took like a giant scroll of paper and had a comic that kind of went through linearly like before and after treatment, but then the in between of treatment was like this really non-linear kind of um winding road of different types of treatments, treatment experiences, and the ups and downs. And then at the same time, we had like uh, firsthand quotes from their research that we were including, so that it was very much grounded in reality. But yeah, they were like drawing. They were doing like the majority of the drawing was them, not me, for it. And they were so into it, and it was really beautiful. And in the end, we made this giant banner that they're hoping to kind of have hang in their department somewhere. I think that's the goal. It was very kind of fragile, so we'll see if it made the trip. I think the other really weird thing about that collaboration was that one of the members of the team that was working on the project just coincidentally was a patient of mine in like my allergy practice from like 5 years earlier. And so the the first morning we started working, she came to me and she's like, I think you were my allergist. And I was like, I was, and I'm here now. It was very funny. So I was like, yeah, that's why I have Fridays off. I do things like this. But it
That's
was really
amazing.
funny. So she like, so we definitely had like different ways of interacting as patient physician and now as like collaborators on a comic. So it was really fun to do that with her.
Very cool.
So yeah, I think and then yeah, I think that there's still plans on kind of what how we'll share these things. I think there probably will be a way that it'll be more kind of like publicly available for others to see the work we did. But I think we're working on that now. But I think we can, yeah, at least share the tidbits of what we did here, and hopefully there'll be more to update later.
And I think it has become, I hope, and will become, as it's articulated more clearly, a model for this kind of work moving forward.
Yeah, definitely. I think, and that was what was great about the project is that I think that no one really knew what it was going to be like when we went into it. So I think now that we did, now I think we have a lot more ideas in terms of not necessarily things to do differently, but like what other things could we do this way? I think that was kind of the takeaway I got from it.
Yeah.
All right. Well, coming up in today's episode, we have a chat with one of our graphic medicine pals, Grace Farris, about her new book, See One, Do One, Teach One. And yeah, it brought up a lot of memories from training that it'll be fun to talk about. But first, some graphic medicine news. I was going to have music this time. I forgot.
Do you want to play it and cut it in,
Did it,
or
did it. Sure, here it is.
nice? All right, news from the graphic medicine website. My big news is that the GMIC 2026 awards shortlists are set. By the time this is posted, you will know what they are, and we'll drop in a few visual cues from it right here. And they are 15 shortlisted comics, 5 each from 3 categories: educational, long form, and short form. And now the judges begin their deliberations, and winners will be announced at our conference in Baltimore.
Great. We are very excited for that. And yeah, once again, the conference, July 23rd to 25th at Hopkins. All the information about registering and hotels and all that is on our website. So please do that. There's group rates for many of the hotels, and I think there's a hostel as well that has some limited space there. So please check it out and book things while they last. So news from the GMIC board. The big news we have is we have 2 new board members that we're excited to welcome to the GMIC board. So the first is Jen Leach. She's a New York-based artist and writer working at the intersection of healthcare, narrative, and design. By day, she drives student well-being communications and initiatives at New York University, where she promotes health, literacy, and population health. She has her MS in narrative medicine from Columbia, and she can be found on Instagram at Furtive Doodles. If you haven't seen her work, it's amazing. Her projects include Side Defects, No Agony for Defeat, Boobless, and Placebo Plushies. So we're
Those are
really
2 of the
happy.
plushies over my shoulder there, right
All right,
there.
perfect.
Yeah, there they are.
I think I have the Agnew defeat somewhere back behind me. Yeah, that's great. And then our other new board member is Soha Bayomi. She is a political theorist and historian whose work examines the intersection of health and social justice and medicine and the medicine politics nexus. Her research and teaching focuses on medicine and authoritarianism, gendered aspects of healthcare, and the visual cultures of medicine, science, and technology. She is a teaching professor in medicine, science, and humanities at the Johns Hopkins University's Krieger School of Arts and Sciences, and is a member of the Department of History and Medicine at Hopkins. And she is one of the organizers for the conference. So it's perfect timing to have her join the board because we'll be seeing a lot of her at the conference. And we've been working with her a lot in planning for the conference as well. So it's great timing to have her join us officially on the board.
Very exciting. Wonderful. Welcome to the Graphic Medicine Podcast, Grace Farris.
Thank you. I'm so excited to be here and honored.
I'm going to do a quick little intro here. Grace, you are a physician in Austin, Texas, and author illustrator of the new graphic memoir See One, Do One, Teach One, which is The Art of Becoming a Doctor, which is out now. Grace is a contributor to Cup of Joe and National Public Radio Shots, and her comics have appeared in the New York Times and Vogue. Grace is the creator of several other books and a long-term member and friend of the graphic medicine community. Congratulations on the publication of the book.
Thank you. It's exciting for it to be out in the world because I've been working on it for a while. So yeah, it's exciting to have people reading it and kids reading it.
It's great. I mean, I think MK and I were talking about this before, but it brought up so many memories from training that it was fantastic to read through it, and it was just like it unlocked a lot of memories, for me as well. I think one thing is that I didn't realize this, but we did our training like basically at the same time, so like a lot of the
Nice.
specific timing and the references, I was like, yep, that was exactly. Scrubs was on TV, and I didn't want to watch it then. Yep. So yeah, it was great. So I felt like, yeah, a lot of, similarities to your experience. And it was great kind of reading through it, because part of it is that like a lot of these memories, like you kind of just go through, you don't really think about it, much. And so kind of seeing it all laid out again and through your experience was really great. And yeah, so it was a really amazing read, and just kind of going through the process of, med school through finishing residency, and getting married and starting a family, through all that. That's such a common experience for so many in medical training, that it's so rarely kind of talked about in a story like this. So I thought it was great. So my first question, I guess, was, how on earth did you have time to do this with your day job? That's I'm fascinated
Ah,
by just the ability to make this work while you're also, you're still working as a hospitalist, correct?
yeah, I work as a hospitalist, and so my workflow has changed because at the beginning, like back in like 2018 to 2020, those were the days when my kids were still pretty little, and they would go to
Hmm.
bed at like 7 p.m. ish, and I'd have kind of like time in the evening. Because my at that time my husband was like working. This was when we were living in New York City, and he was working like downtown until late a lot. And so I would have all of this kind of time to do comics. I was doing a daily comic back then. Now, now I live with like a teenager and a tween and my husband, and they all like, want to like hang out, watch something, play chess, etc. So that like time in my like comics laboratory studio has dwindled in the evening. But now, so now I do hospital medicine, so I'll be on for like last week I was on for about 7 days and finished up, and now like this week I have a few days off. Today I'll go into work at like 4 to 11 p.m. So it's kind of you know I think maybe for my family it feels more chaotic, but for me it's like a nice mix of different times and whatnot. So I have more kind of time during the day when the kids are gone and at school. So that's mostly when I worked on this. But I do think like doing the daily comic helped me prepare for like, just kind of this idea of like little by little, like just do this one page today, or do a
Yeah.
spread today, and then come back to it tomorrow. Or sometimes you get on a roll. Um,
And did you drew a comics in college as well, right?
Yeah, I did a daily comic for my college newspaper that was called Coupe de Grace. And I mean, that was pre iPad, pre, Apple Pencil. And so that I was doing, on a daily basis. And then I would rush to like the library to scan it in like
Yeah.
11 p.m. Uh, so
Yeah.
yeah, a little different, workflow back then too.
No, I think probably at the same time I was also drawing a daily comic in our undergrad paper, and it was, yeah, very it dominated college. For me, it was like all about like making the deadline each day. That's all I thought about.
Yeah. Yeah.
But it
But
was a
it's
good,
good
yeah,
practice, I think, and
absolutely.
for coming up with ideas and learning that. Like, I feel like once you get into that habit, like
Yeah.
it's like a muscle, it's just you're kind of accustomed to it.
Well, I tried to do it in med school, and I made it like maybe four comics, and I was like, no, I can't. I lost track. I was like way too busy.
Oh.
But it was one of those things where I thought I was like, oh, I could keep doing it. And I was like, no, you couldn't. But yeah, so you kind of did you draw at all comics during your like during undergrad residency time, or did you have, or was it like not a?
Well, after the daily comic during undergrad, during med school, I thought that that would be it for me in comics. And I had a friend who told me like, "Oh, yeah, that'll be a good like two truths and a lie." Like when you're like 45 and you go to a party and you can say like one of my two truths is like I drew a comic strip in college. um, but yeah, so I really didn't think that that would come back. And I was doing more like painting.
Yeah,
I still had my oil paints back then. So when I was in residency, if I had a vacation or um, something like that, I would do more oil paints and gouache, but I wasn't doing comics. And then um, when I became a hospitalist, I think around 2015-ish was when the Annals of Internal Medicine like published the comic and Michael Green wrote. And my boss was pretty involved in like the Annals of IM community, and he told me like, "Oh, you need to get back into comics." Like, he knew I had drawn a comic in college, and so he said, "Oh, this is happening." And yeah, and then I went to my first graphic medicine meeting a few years later, and I was like, "Oh my gosh, this is magical."
yeah, yeah. That's so funny because I when I read that, that part of the book where that it was a physician who was kind of telling you about graphic medicine.
Mhm.
Similarly, that happened to me as well, where I was like not drawing comics, and then a co-resident of mine who was like into library sciences was like, "Have you heard of
Mhm.
graphic medicine?" And I was like, "I have no idea." And then a year later, I think I met MK for the first time, and that was, yeah, same thing. It like blew my mind and changed like everything I did
Yeah.
after that.
You had this great quote back then, Alex, about finding the mothership.
Yes,
Yeah,
that's what it felt like.
yeah.
It really did, because yeah, you're just kind of working in isolation, and then it's like, oh, there's a whole world of people that are doing this and thinking about this, and yeah, and every year, like I feel like every conference, you find people who are also going through that same experience where they're
Experiencing
like,
that.
oh,
Yeah.
this is a
Yeah.
thing, and I had no idea. Yeah, it's
Yeah,
great.
yeah, yeah. So when Alex and I were kind of like, usually we put together a nice little script and it's got clean questions and it flows, but right, honestly, each of us just came with like chunks of things, and we're like, we have
Okay.
so much to respond to. So I'm going to
Okay.
start towards the beginning of the book, if that's okay, Alex.
Yeah.
Um, and I wanted to, and we also vowed to each other that we're not going to like go down our own reverie because we had so many sort of experiential flashbacks. So,
Mhm.
so obviously I didn't go to medical school. I went to nursing school, but there's a lot of crossover similarities, especially the touch points where you talk about responding to patients, right? And we'll get to that. But I wanted to start even further back. First of all, I think it's hilarious that you'd never heard the term the runs. That just cracked me up. That you were humble enough to actually put that in the book. I loved it. I loved it. But that's not what I wanted to focus on. Anatomy and Physiology Lab, right? I have a colleague, Catherine Belling, who writes a lot about the experience of a new student to medicine, their first exposure, their first patient, right, is this cadaver, and that she writes a lot about horror in medicine, and she writes a lot about how the response is supposed to be, you're supposed to act like this doesn't impact you, right, and if this impacts you profoundly, then maybe you're not fit for medicine, right. So I think about that a lot, right, and so I love that you portrayed that and I, in fact, I texted her last night like, you've got to check this book out, but one of the things I wanted to just go a little bit down reverie is that, so I trained 10 years before you guys, and I trained at a state school in anatomy and physiology lab, not part of nursing school, but I did it as a prereq. And things were different. So there wasn't the covering of the face and the hands. In fact, we were given extra points if we showed up at the loading dock and just literally hauled the body bags off the ground, threw them onto gurneys. And it was just very, very different. And the faces and were never covered. And there wasn't this sense of gratitude. It was very much of like functionality. I'm kind of curious about, and this isn't really is super relevant other than just reflecting on the fact that in probably at a 10-year time frame it did change, where that came about, like like how did that happen? I mean, this is not in your book, but I'm just sort of curious because it just strikes me the appreciation and like what I wished had been there when it changed. Any reflections on that from either of you?
I mean, I think that the professors, Steve and Dale, the ones who are introduced in that chapter, I they were not in medicine. They were more in like vertebrate biology. And so I got the sense that it was a combination of they're both like great role models, it's very humanistic, but then I also got the sense that it was also related to just keeping things functioning smoothly, and like that they had to provide a lot of like guardrails. They had to say we keep these things covered. I think I didn't end up including, like, they made a big point about saying like you can't remove organs and like take them out of the lab. We don't want them to show up anywhere strange. Like, we don't want it to become like anything grotesque. Like, this is like very, sacred. And I don't think they would have said sacred, but like, they definitely kind of like made it clear that this was like a very generous donation, and that if anything bad, like if anything happened with the cadavers that wasn't professional, like we would be in a lot of trouble, that kind of thing. So I think it was kind of the culture of the lab. I don't know if that was your experience, Alex, with your
Yeah.
anatomy lab.
No, it was very similar because we also had like a candle lighting ceremony at the end of the term, kind of as a kind of a sign of respect for the folks that donated their bodies. And I think it was, I think also everyone, all the med students were also like so freaked out that like being kind of like respectful was like the best way to handle it. Almost is that the reverence was a way of
Yeah.
kind of containing like the anxiety in a sense where I felt like there was a lot of reverence for what we did. Now that said, there was like times where like something crazy would happen and everyone would like run to see something weird on a body. So like I think it was our body. I think our cadaver had like an artificial like penis pump thing or
Oh
something
yeah.
like an
Yeah.
implant. And so like that was like a big day where everyone wanted to take a look at it. And so that was like, but still there wasn't like laugh. It was more just like fascination and stuff. But there was,
Yeah.
I remember that day, like, everyone like ran to our cadaver once we like noticed it basically. But yeah, I think that there was a lot of that like reverence and also like anxiety that everyone was trying to like contain, and it was more like you fake until you make it kind of a behavior where everyone's just
Yeah.
trying to
Oh
be
yeah.
professional before they actually were professionals. One thing I never thought about until reading, the section in your book was like, I don't know, Grace, if you ever did like figure drawing classes or like anything in art training, but like for me, this actually, I finally made the connection of like, I felt very similar like with my first nude figure drawing class, where it was something where like you were, and my first nude drawing class, I was 14. So that was also like, it was a very odd age to be doing that. But like, I remember similarly, I was like so concerned about how I was going to behave that that was kind of consuming me prior, but
Yeah.
then once I started drawing, I like forgot all of that and got like locked into the job at hand. And similarly, like in the anatomy lab, it was like the anxiety of the cadaver melted away as soon as we had like our first task to do. And then I like kind of didn't that this the fear about it and the anxiety about it kind of went away because there were just too many things that we were focused on.
Yeah, I had done anatomy drawing before, but then at the end of med school, I actually took an art class at RISD that counted towards my graduation requirements, which was amazing. And that was an anatomy class for the final week. After doing kind of the nude anatomy for a while, we went to the back to the cadaver lab. So it was this like in like nice full circle moment.
Yeah.
Where we drew from the cadavers, and that was nice for me because I've been drawing a lot of the cadavers like during the first year also. But I think you're right that it does have that similar, yeah, like where it sounds like it's going to be scintillating, but then instead, yeah, there's like kind of a really interesting, yeah, kind of like historical aspect to it too.
Yeah, yeah, absolutely. One thing I also like I mentioned a little bit was, because I think we did training at the same time. And what was your relationship with yeah, like medical TV shows during training? Because I know for me, like I think that Grey's Anatomy premiered the night before my first like third year inpatient thing, like or
Oh,
something like that. And so I remember like I watching that episode like gave me a panic attack because I was so freaked out about going to the hospital. And then for the rest of training, I couldn't watch any of those shows. So they were like very popular at the time of our training, but I like couldn't consume that mass media.
I was really into ER in high school, and
Yeah.
probably that had like a huge impact on my career decisions. And then in college, yeah, I wasn't watching a lot of TV. And then I also watched the first grade, like the pilot of Grey's Anatomy, because I thought, oh, this will be relevant. Like I'm in med
Yeah.
school, and then it's I mean, it was just a little too, yeah, it was so dramatic. And I don't know, MK, if you've seen the pilot of Grey's Anatomy, but it opens with like a one night stand between Meredith Grey and the guy who plays her supervisor, but she doesn't know he's going to be her supervisor. So yeah, I don't know. I just remember watching that and thinking like, well, this looks interesting, but I'm not going to have time for this. But yeah, maybe one day when I'm sick or something, I'll watch all of them.
I've heard
Yeah,
that show is still running. That is,
it
Yeah, it
is.
is. Yeah.
that's
It's like
insane.
18 years or something.
Yeah. I
Yeah.
mean, and now it's like so ungrounded from reality that it doesn't actually, yeah, it's not like, it's not triggering because it's like not even remotely realistic. But the first season probably was, I think. But yeah, I
But
just
I
remember at the
I have
time.
the reaction you have now to The Pit. Like I've tried
Yes.
to watch The Pit and I just like I can't even make it through the pilot because I just find it a little bit too intense and
We
like
we just talked about that exactly.
Yeah.
Yeah.
Yeah. I
yeah.
can't watch it. I can't watch it. Yeah. Same thing. But
Yeah.
the really funny thing is that, so my wife is also a physician. And so we, used to watch religiously, that Bravo show Below Deck. Um,
Oh yeah,
and
yeah, yeah.
so that show, it's like high end super yacht where you follow like the crew, the
Yes, yeah.
service staff, the crew, and then also like these really like annoying rich people that are renting out the boat for a week or whatever. We used to watch it religiously, and then we're both in like outpatient medicine, and there was like a certain kind of stressful time in both of our jobs where like Below Deck is triggering us because it's making us feel like work. It's like dysfunctional
Too intense,
staff and like
too much pressure.
demanding clientele.
Yeah.
It's like it was like almost like watching a medical drama because it was like outpatient medicine was feeling like being a chief stew on a yacht.
Yeah. Yeah, yeah. I believe it. Yeah. I need like Bridgerton, infuse it into my
I
veins.
know. I need total, yeah, total escape. Give me like Andor or something. Yeah, I'll do that instead. Yeah.
So I asked this question of everyone who does a book, and I think maybe it's obvious, but I want to hear it from you because I think it's interesting to think in this context of this book. What is the work that you want this book to do in the world?
Oh, that's a good question. Well, there are a few things. My audience, I'm always trying to make something that I would have found helpful or that I would have like clamored for. And so I read a ton of those medical memoirs, like as a high school student, pre-med. Like Perry Class has a book, and then Atul Gawande has a book about residency. And so I wanted it to be like that, but and I wanted it to be like the type of thing where if you're a pre-med, you're learning stuff about medicine because that's a core part of those books is like you get to learn a little bit, but then I also wanted it to kind of pull back the curtain on the non-clinical parts of it because I was very curious about that when I was in high school and college, like what my relationships would look like and what the day-to-day might feel like. And so those were some of the goals. And then I felt like if I didn't explore things that had made me feel bad during that time, then like, well, it's not even worth it because I think like showing things that at the time either made you feel ashamed or were like huge, obstacles like is important to kind of share with other people. So those were kind of the two guiding parts of the book.
I mean,
Nice.
I feel like it was very, I mean, what I appreciated about it was how realistic and grounded it was. So, it wasn't that there were all these like horror stories of like terrible things that happened, but also it wasn't all, a perfect experience. It was kind of like a nuanced thing where, a resident would say something horrible and you wouldn't know what to say, then that
Yeah.
was like all of med school was that basically,
Yeah.
where like
Yeah.
you don't feel empowered to push back, but you're like traumatized by the crazy thing you just heard and you just kind of
Yeah.
internalize it. And and swallowed. And that I
Yeah.
feel like is such a realistic thing that I've not really, read or seen about, on like other depictions of training where it's like, yeah, not everything is like this dramatic battle because you can't do it, but it's also not something that bounces off your back, but it's like you just kind of you go on and similarly there's a one scene where there's that mother who came in with like a super preterm baby who basically had a stillbirth, and then
Hmm.
like it was I think the attending kind of knew how to talk to her about it because his partner just had a baby or something like
Yeah.
that. But then it's
Yeah.
like then he just went on to like morning rounds. So it's like
Yeah.
what was his experience with that like that? I mean, that's fascinating that like that is just like someone's day was that, I mean, not I mean the physician, of course, the patient obviously too, but like just that there's so much like traumatic things that you just kind of swallow up and just keep going, and that's like happens all the time in a hospital.
Yeah, yeah, exactly. I thought and like that attending, I remember being very moved by like how he handled the whole situation. But yeah, then it's just like you don't even have time to like debrief on that. I guess I mean we were doing a lot of debriefs on like codes and things, but I guess that didn't even meet the debrief, criteria really.
Yeah, I mean, I think that that's one thing that graphic medicine has been really good about, and that's kind of what opened my eyes to it early on. It was like that part of it that in medical training, I think we're not give at least at the time when I did training that we weren't given time to like process or like talk about those emotions. It was kind of like go on, just keep going.
Yeah.
And then it's like there wasn't like a healthy way to do it. And I think it's like at the time, I don't think the schools had a good way of making time for that, or I don't know what. But and I'm not sure if that's different now. But I do feel like graphic medicine and the ability to like read about physicians and patient experiences is a way of kind of like processing that information that you were not given a chance to do when you were in the experience.
Yeah, I think you're right. I think it's I always think about how like the thought bubbles and the speech bubbles, like how you can have both of those in an image and how like that's like perfect for any kind of healthcare encounter where everybody's thinking about something different and
Mhm.
what's being said is just like the tip of the iceberg. But yeah, I think it is a nice way to like show, yeah, some of those smaller moments or the moments that you just kind of rush through. Yeah.
And in drawing about them, it is an opportunity to reflect on them, right? Just like,
Mhm.
yeah,
Yeah.
yeah, yeah. So I know that every creator who represents situations that involve patients has their own way of addressing this. But how did you handle patient confidentiality in your text?
Oh, yeah, that's a good question. Well, so part of it, one of the people at the publisher pointed out that this is like all from 20 years ago. So I don't know that like my memories are that perfect. Like I definitely remember everything from intern year like pretty clearly. And I have like, journal entries and bad poetry to look back on. But I think otherwise I would change like either the like the gender or some of like the identifying details to make it. But I think that's the other thing about patient confidentiality that is interesting. Like at that time, like when you're starting off, everything seems very unique and like you see like a wedding in the ICU and you're like, well, this is like, this is like the first time this has happened. And then like now, I've seen like a million weddings in the ICU, like it's just, yeah, everything that seems like it's like a one-off is actually like there are so many different variations, but yeah, more common. But yeah, that's how I handled it.
Yeah, that's kind of what I was wondering about as well. It was how clear your memories of everything were, because I think for me it was like reading your book brought like snapshots from my experience, but I don't think I could recall like with the level of detail like some of the experiences you went through. So I guess yeah, so was a lot of it like just in your mind, or you had like journals that you were looking back on to like remind you of experiences, or how did you navigate that?
Yeah, so I kept like a pretty short-lived like intern year blog, so that was helpful. And then I had like, yeah, a lot of poems. Like I had a whole poem about long-term non-responder because that phrase is so
Mhm.
evocative and sounds so negative. It's actually like a great, it's actually, pretty positive. So yeah, using those records and emails like that I had been sending. So, but most of it, yeah, I think is like from memory.
Yeah.
It
Who was
didn't.
reading your blog intern year?
Oh, unfortunately, like the my co-residents, and then
That's
someone
amazing.
shared it with a social worker who like was concerned that I would make a mistake or that I wouldn't anonymize things or that it wasn't above board, which was a good concern. And so she shared it with the residency, and then the residency
Wow.
director told me like. I don't understand like why you're keeping a blog. Like, can't you just keep like a document in Microsoft Word? It was like early days of social media.
Yeah, and now we have like med influencers on TikTok and all that stuff. Yeah,
I know
that's
I could have been Kevin MD. I mean, that's like that. No, no, but it was. I mean, I appreciate their concern, and it was helpful. It definitely has made me think like, yeah, you can't ever publish anything that's anonymous. It should always like be under your name,
yeah.
and then always trying to be like really careful because we have like so many blind spots about things.
Were you aware of that controversy of that med student that did this like wildly
Yeah,
inappropriate like
yeah,
TikTok?
oh yeah,
I think that brought like a really good discourse about like the ethics of like doing stuff online relating
yeah.
to patients, because I think that was like not something that I'd heard anyone really talk about like any guardrails. So I think that was a useful, you know, thing to kind of bring that conversation up, because I think
Yeah,
that, like at the time that you and I were in training, it's like the internet, like the technology was changing exponentially.
yeah,
And so then there's like these new things that like your program director never probably had to deal with, like, what do you do with a blog? And, writing it
yeah.
on Word is like, that's not the same, you know? So that's like a really interesting time as well to like be in training, because it's like the way that we are communicating about our experiences is like unprecedented and compared to previous years.
Oh, definitely. Yeah, and I think I mean that the influencer who posted that, like sadly, like that's almost like a conversation that you have to have about like OR culture in general. Like that, yeah. And I think there are so many videos and things like that now probably floating around on TikTok. Uh, but that, yeah, that was like particularly egregious.
It's also tricky because I think that with like this rise of like medical influencer culture,
Yeah.
I think that
Yeah.
a lot of like med students are like aspiring med influencers, which is like such a
Yeah.
weird, like nihilistic goal to have, And so it's like also like the fact that, because I think it was like a med student that did it. It's like what on earth were you thinking? And that part of it also was disturbing, that they were like, that people at that level of training that were like feeling comfortable enough to like, you know, uh, be
Push.
that confident with their inexperience and irreverent with something that they don't have no understanding of. And I don't know, that all of it was really weird. And I just worry about that aspect of things, that there's this like a secondary goal of like, followers and popularity online, which has like nothing to do with like why you're in, training for
Yeah.
medicine.
Well, and I think it's even more complicated because like the loans are so high now
Yeah.
and costs are really high. Like even here in Austin, like the cost of living is like skyrocketed, but the resident salaries are not keeping pace with that. So it's just
Right.
like, yeah, there are a lot of like financial incentives to become a med influencer. Um,
Yeah, I mean, my siblings are both physicians, and they both work with residents and med students. And one thing, we had like a very interesting discussion about this last week, just about their frustration with some of their students kind of just not being as like super engaged as like they were when they were that age. And they were saying that it was like, for example, my brother is an ER doctor, and like the idea that like a med student or yeah, I think probably more medicine would like leave when their shift was over, even if like their patient was like crashing. Like that was something
yeah,
that really like bugged him. But I kind of brought up your point. I was like, we're like living in a world where like things are so transactional with healthcare, and like the physicians are not being compensated in the way they used to. So like I think that level of like respect is not like afforded to those in training as maybe it was before. So then they're also treating it like a 9 to 5 where you clock in and clock out. So I was coming on the side of like on the student side was like, yeah, what do you expect? But they were like, yeah, but that was like a point of like they felt like things are different now with like the newer generation of like trainees.
I think, yeah, I think actually that was like a plot line on one of the Pit episodes where
Oh,
the
was it really?
student leaves early. Yeah. And I can't tell if it's like, if there's a generational aspect to it or, um, yeah, I'm really not sure, like, because I still work with a lot of residents and students when I'm on service, and I I think sometimes maybe it's just more personality because I definitely have a lot of like very dedicated residents and students. So that's I'm always not sure if it's just another like, stop spending money on avocado toast thing.
Right, right.
Like,
Yeah, yeah,
I can't. I mean, and also like that's the other part is like I feel like it's very inspiring to meet anyone who went into healthcare like 2020. You've seen
yeah.
like everything, like we let it all hang out, it's like the worst. And to be still called into healthcare seems like, yeah, that's very inspiring. So I'm trying to cling to that.
I also think it's like so much harder to get into, medical school than it
Yeah.
was like even
Yeah.
20 years ago. So it's also like the people that are getting in are also like super way more qualified than I was, I know. So it's like I don't know if I don't know, maybe it's a generational thing as well, but I do feel like having boundaries is not a bad thing either, in terms of like
Yeah.
what your
Yeah.
expectations
Yeah.
are. Um, so one thing I actually want to talk about a little bit was your experience with the the like toxic residents, let's say. Because it's very interesting because you had like I think it was the surgery resident who was kind of saying a lot of like wild, inappropriate stuff, kind of off the cuff. Um, but then at the same time, like the OB residents were also like kind of toxic in a different way.
Mhm.
Um, what was that something that you felt like was common with like your med school cohort in terms of their experiences with residents? I mean, for me, it was like, yeah, surgery and OB were like the hardest ones for like toxicity, but I don't know if that was like a generalizable thing or something that was just unique to like my experience.
Yeah, I think, well, like one of my roommates from med school became a urologist. So I am assuming that she had a very different surgical rotation than I did, because she became a surgeon. But yeah, I mean, well, with the toxic residents and all of those things that they're saying, I feel like that I had to like tone down a lot because I don't want it to be like, and even the stuff that I included, I was doing a lot of hand wringing about because I don't want to like um, normalize that. But then I
Yeah.
also really needed like an example of like how how as a student you're not in a position to like argue very much because you're going to be evaluated by this person, and that was like me feeling like not very brave or like like I was helping anybody. So um but yeah, I think I was asking a friend who's in nursing school right now, and she says that like those types of comments are still pretty prevalent. So I
Yeah.
think the fact that I don't hear them anymore is not really like, I'm not sure how much culture has changed, or it's that
Right.
I'm just not hearing people say unprofessional things. Um,
One thing I was talking to my wife about this with our both of our like med school experiences, and I also don't know how true this is now, but it felt like to me at the time, like the surgery rotations tended to be more like male dominant in terms of the residents, at least in where I did training. And it tended to be harder for the male med students compared to the female med students. And the opposite was true with OB, that
hmm.
OB tended to be easier on the male med students than the female med students. And I don't know if it was like a gender dynamic with the residents, but like my wife had the same experience where it's like she had a horrible experience in OB and surgery was like bad but okay, and mine was like the exact opposite. And unless if you noticed any kind of like gender related issues with those two specialties or anything, and when you were in training.
Yeah, well, the surgeons were all men, and the surgery residents were mostly male, and then the OBs were, most of the OB residents were female, but the chair was definitely male.
Hmm.
Yeah, I thought, and I still do think that there's just a lot of like gender equity issues in medicine,
Yeah.
um, and I think now there are like great studies where it's like patients will send 25% more messages in Epic to their female provider than they will to their male provider. There's like
Oh, wow.
the expectations are very different of female doctors. It's like, and I don't mind going to get like a popsicle or a glass of water and then nourishment, but I mean, I do that every single time I'm on any shift. And I don't think it's the same for most of my colleagues. Yeah.
Yeah, I mean, I know for sure my wife, like it's a common issue where like male patients won't call her doctor or call her by her first name when she's not introducing herself by her first name. And that like rarely happens to me. So that for sure is like a gender dynamic issue.
Yeah. Yeah.
Interesting. Interesting. So I was caught just kind of going to, not to change channels, but I just want to, we've got such long lists of things we want to talk about.
Yeah.
So just kind of thinking about, so I was not surprised to hear that you, because we both had independently written, like, how did you remember all this stuff? Like, did you have notes and whatever? But I was not surprised to hear that you had poetry, because um, a lot of what seems to have caught you were words and expressions that are common in the work, but the general public may not hear them, right? So things like interstitial being your favorite word. I was sort of fascinated by, like, oh, that's the gutter, right? Like, that's the gutter in comics, right?
Yeah. Yeah.
I couldn't decide, should we start calling the interstitial area the gutter of the body, or should we start calling the gutter in comics the interstitial area?
I like that. I like
Well,
that
there
one.
there are some gutters in the body. There's like the
Oh
uh,
yeah.
yeah, the colic gutter maybe, or there's
Yeah.
a gutter
Yeah.
behind the gallbladder.
There you go. Yeah, yeah. But so anyway, so I thought about words, and then you had a couple of other things, like you mentioned the one about the chronic non-progressor,
Mhm.
and also got fixed false belief was in mental health, was interesting.
Yeah.
And then, but the last one, and I wanted to kind of just zero in on this because I've heard you present on this topic, and I just love it. The wish, worry, wonder.
Oh yeah. I thought that's like a palliative care expression. And I looked it up to see if somebody had trademarked or where it came from, but I didn't get very far. So I need to look back to see who is the author of that. But it I and it's when I first heard about it in a presentation, the speaker said, "Oh, and sometimes I'll use this like in my relationships outside the hospital." So I do try to use it when I remember. So it's an interesting like conflict um, technique where you say, like if you have something stressful to talk about, it's like, um, yeah, like I wish that, your father didn't have heart disease. I worry that it's getting worse and there might not be like any more interventions that will work. And then sometimes you don't even have to get past worry because that like opens up a conversation. Or you can go to, and I wonder like what he would choose if he weren't like on a ventilator right now, or that I like that structure. I think it's like not judgmental and it's kind of like leading with like curiosity. Yeah, and I thought I liked using it also for one of the last chapters because it's like this is like I had been like wishing for so long to become a doctor, and then I was like worrying for a long time, and now I was like
Yeah.
wondering like what's next. So it like mapped out really nicely.
Yeah, that was a lovely parallel. Yeah.
One thing I also really liked in terms of how you told the story was that it was very like self-reflective in the narrative as well. So that like I think specifically like when your husband proposed to you, you were like as you were writing it, kind of reflecting on it as you were also telling the story. That was like a really interesting way of kind of telling the story, but knowing that the person telling the story has already gone through the experiences and is like reliving it and thinking back on on things. And once again, like the language of comics and having like narration um squares and rectangles is a really like useful way of doing that I think in prose wouldn't be as like seamless, I'd say.
Yeah, I think I wanted that like scene to be like to show like some of the like the shame of educational debt, but then I didn't want to like leave the reader like in this morass of shame. So like, just to be like, don't worry, it's okay.
Yeah, there was a
And
lot
then
of thoughtfulness for your readers, which I appreciated. Yeah.
yeah, absolutely. One other question I had was just, because a lot of the work I do is like drawing medical environments. And so one question also was like, what do you think like in terms of like what to include and what not to include in like drawing these scenes, like in terms of like the technical specifics, like was it something where um having details would distract or tell more in a story? Like how did you make decisions about like depicting the more technical like medical scenes that you were in?
Oh, well, some of the sometimes my editors wanted more details on like they wanted to see the surgical knots and
Hmm.
um I think some of it was probably like limited by my skills. And then I wanted there to be a lot of like really nostalgic like New England images and like images of restaurants that don't exist anymore.
Yeah.
To just yeah, have that like atmosphere, I think.
Mhm. Yeah, I think it's because a lot of times specificity is a good way of like showing the reader like this is real and this really is
Mhm.
a true thing. But then it's like too much detail can also like be overwhelming, especially if you're like not a medical person. If it's
Yeah,
like
or you're
there's maybe not
squeamish.
a need.
Yeah.
Yeah, exactly, exactly. I really liked I'll cut to it now, but the on page 208 you had like the music, like the cacophony of a hospital.
Oh,
That was a great like depiction of like a noisy hospital visually. Um
thank you.
and and it was like not necessarily a negative thing also, which was good. Because
Oh,
for
good.
me, I personally like did not like the noises of a hospital, but I think that was like for me that was like a personal thing because I think a lot of people like that how a hospital is busy and active and noisy, so it's not necessarily a negative thing.
Yeah, I had that particular day I remember very vividly because I maybe because of the noises because there were so many like sensory inputs.
Yeah,
And I remember that resident like kind of like sailing over the sounds of the hospital to like do a nice job and be
yeah.
very supportive and like know exactly what she wanted to do. And I wanted she that unfortunately that resident like died very young. She only died like
Hmm.
a few years after that scene, and so I really wanted to like have some images of like what a competent physician she had been because yeah, she was very inspiring,
Yeah.
especially in that serotonin syndrome patient.
Wow. Did you so like yeah, I guess your like classmates and co-residents, did they know you were working on this as you were working on it?
Some of them did, like my friend David, who's in throughout the book. He knew about it, and then the my friend Chris, who was one of my anatomy partners. Yeah, a bunch of them knew about it. I don't know if they were envisioning this, but they, I would send some of them pictures and be like, "Oh, look, I'm like drawing you today." And, what are you gonna say?
And were they wanting to give their like insights on anything, or was it something where you didn't need their input?
I think like people in medicine are really supportive, or at least
Yeah.
I have been fortunate to have a lot of like very supportive physicians I'm around like throughout my career who like are really encouraging. Even Chris, like in anatomy lab, saying like, "Oh, well, maybe you'll do art and medicine." I feel like I've had lots of people like that who are really positive about it, so that's been good.
Yeah.
Um, yeah, I just have a couple of other touch points that struck me, and we could do this forever, but one of the ones that as a nurse I really resonated with was when you say, and you just sort of say this as an aside after a lovely encounter. You say it turns out it doesn't take long to develop tender feelings for a relative stranger. And that's just so beautifully put. I think I would have used a lot more words to talk about that, but I just love how perfect that is, and it's just really hit. That was really beautifully put.
Oh, I'm glad you like that, MK. I'm glad it resonated. Yeah, some of those types of moments I'm like, did I like rush through this moment, especially in residency? I did rush through, and I guess in some ways that's like authentic because you are like kind of rushing through residency and it is all crammed together and like but then yeah, some of those scenes you're never sure like how long they should be. And especially with that patient who yeah, was very memorable.
And that's such a good like distillation of like healthcare though, where you are kind of like trying it, when you succeed, when you do a good job, you are making that, really powerful connection to essentially a stranger. And then at the end of the day, you're drained because you've done that all day. So there's that part of it too, where it's like it does take a lot out of you to make those connections that are very real, but then they're also with people that you're just meeting for the first time potentially. It's a very odd thing that we all do in healthcare. That is, I don't think it's been as described as succinctly and eloquently as MK points out.
And also it gestures to something we both made notes about, is this idea that oh, I just lost my train of thought. Uh, oh yeah, the simplicity of a question from someone outside of that environment, right? So as the reader, we see all what you've been through in a day or like a month or whatever. But then just that simple, not so simple question, as you put it, Alex, how was your day? How is the month going? And you get asked that question, and it's just like, it's such a big question, and yet how do you even begin? And you basically are like, fine, because it's not like you're going to go through what that whole day or that month or like and all those, yeah.
Yeah,
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 I think about that a lot still because like my husband's not in healthcare whatsoever. And like last week, I had a very young patient with cancer, and then I got home and there was like this argument unfolding about chocolate milk. And finally I was like, guys, like I am seeing someone who's like probably not going to be 30. And I cannot have chocolate milk. Like I can't choose a fighter, and I can't like be involved in this. And I think like there have definitely been times in the past when maybe I would have not said it so carefully or would have like exploded or something. And I think that saying it that way helped because it definitely like diffused the situation. But I feel like that is part of being in healthcare, is like you're coming home and like somebody's asking you like about wedding planning or what do you want for dinner, and it's like the train is not in the station yet. I'm still like thinking about things or worrying, like did I remember to like ask ophthalmology to come or that type of thing.
yeah. I think I'll have like ask me a question fatigue, where it's like
Yeah.
all day people are like asking me something, and I get home and it's like, Daddy, what about this? And I was like, just give me 5 minutes to not answer a question, please.
Yeah,
Yeah.
my line was actually, I'd say, I'm not taking questions just yet. Give me 10 minutes. Yeah.
So one question I wanted to ask, uh, kind of as we're wrapping up is, the subtitle of See One, Do One, Teach One is the art of becoming a doctor, and I think that, as someone who is an artist and also a doctor, you have a lot of insight in terms of like what that phrase actually means, because I think that that's thrown about a lot, but like for you, what does that mean, and what are there scenes, from the book that resonate in terms of the idea of the art of medicine or becoming a doctor?
I think well, the first time like that I made a diagnosis, that was the first time it was like, oh my gosh, like I am changing, and I don't even know like when this happened, but like at some point like I started to have this like diagnostic ability, and that for me was like a turning point. But then obviously that's not the full picture of being a doctor. And I think one part that's for me, like I became a hospitalist, and like a few months into that period is when I had my first kid. So motherhood and medicine have always been very like intertwined for me. And like however old my oldest kid is, that's like about how long I've been a unsupervised physician. So um I think in some ways like it's similar because like you become a mother, you become a doctor, but you're like, I don't, is this like, I don't have a license to, you're like, it's like, should I be allowed to do this? Should I be allowed to take home this tiny baby? Or like, should I be allowed to be like searching for amlodipine in the EMR? And then like, so some of it is like learn by doing, and like lots of like different kind of mentors. So I think that's definitely a process. And then I guess I had another similar experience where, when you start off in medicine, like when you're a resident, it feels really weird to call yourself doctor. And I had a mentor who's like, the only thing that will make it feel less weird is if you say it. Like the more you say it, the more it'll like sound
Yeah.
natural. And then back in 2018, when I was starting to do a lot of comics and do more like comics for different websites and things, like somebody asked me to do a comic for a website, and I thought, oh, they don't realize like I'm a doctor, like I'm not an illustrator. And then I
Yeah.
was like, oh, this is the same feeling that like you're not, it's the imposter syndrome, which is like really contentious, but like, but that feeling that you're not like, that's not you're not really the role that somebody's putting onto you. I think getting used to that is probably a good thing, and knowing that like that it just takes a little bit of time to start feeling like less of an imposter.
Yeah. I mean, I think it's similarly, it's like when being called like, yeah, mom or dad is also a similar feeling where you're like, I don't feel ready for that title yet. I mean,
Yeah.
part of it, I really loved how like thoughts about motherhood, I felt like we're kind of weaving in throughout the story. And just kind of experiences of people going through birth loss or having kids, things like that. And then I think there's one section where that like lit up for me where you go into the statement that women physicians go into labor early and more often than the general population. That was true with my mom. It occurred to me that my mom went into labor with me when she was on call overnight, and
Oh,
she was in labor, and her program director begged her to stay because she was presenting grand rounds that morning.
oh
So
my
she
God.
did. She did. I mean, this is of course like even like 40, yeah, 45 years ago exactly. Um, but yeah, so she did, and then I was born like 3 weeks early. So that's
Wow.
why
You're like,
during
that was my
residency,
first grand rounds.
exactly. That's why if I was ever like running late during residency, I was like, it's okay, guys. I was born early
Ready
because of
for
residency. So, but it's true. I think that like, seeing how mothers specifically handle residency, med school, all of that is such a very unique thing that I also think is not like given enough respect or like attention to, where it's like you're in a time of your life where people are getting married, having kids, and you're expected to be in this like super intense environment where you're not sleeping well, you're not eating well, you're under incredible stress, and then like this is the window that you're supposed to have kids. It's
Yeah.
crazy.
Well, and that's I definitely wanted to like show a lot of that because that was like one of my big interests when I was a pre-med was like, how am I going to have kids or how am I going to meet someone and like how's this all going to work? And like I'm getting a lot of like cultural messages that like you can't do both and you can't, like and so that was a big part of like wanting to have some of that woven through it. And then the editor, I was going to have it just begin with the anatomy. And my editor, Melanie, was like, maybe you should have a prologue where you're the patient and then you're going back to like learning how to become a doctor. And I thought that was such a good idea because then you get to have this cinematic birth scene. I was just like in so many movies, and it also like enabled me to like have myself like naked from the get-go. It's like to be like, this is how we're gonna go through this story. Is like just like
Right.
nakedness and emotionally, and yeah. So that was a really great idea, I think, for the structure.
Great. Well, we are about to transition to our last and sometimes cherished segment. But before I do that, I just want to make the point that so Ian Williams has said a couple of times that when he coined the term graphic medicine, he kind of half meant it as a joke, like the graphic could be the medicine. So I thought it was really interesting. On the back of your book, one of the pull quotes is, "Even this memoir is medicine." So I thought that was like what a great testament to this as graphic medicine. Yeah.
Yeah, that was so nice. Such a nice quote.
Great. Well, thanks again. We love the book and we hope that everyone picks it up and reads it. I think it's going to be really resonating for anyone in any side of the medical equation, any level of training. I think it just is a really great memoir that there's a lot that you can relate to just by reading through your experiences. So yeah, thanks again. It's wonderful.
Thank you, guys.
So now we're going to go to our next segment. So we're not done yet.
Okay.
So our next segment, we like to talk with our guest about what they're reading, and just kind of go over that. I've expanded to what media you're consuming, so it doesn't have to be a book. It could also be TV show, podcast, audiobook, whatever. But yeah, if you feel ready to start, Grace, what are you currently reading and or
Okay.
consuming?
Well, so I read a really good book at the end of 2025 called The Tokyo Suite, and it's Brazilian. And I thought maybe 2026 will be my year in translation, which is also a good thing for comics because there are a lot of like great French comics. So right now, I just finished reading a really wild book called My Husband by Maud Ventura. That's French. So the year of translation is going well, because it started off strong with that book. I read a ton of romance novels, which which you can find on my newsletter if you want to look at those. And then what else? I think for this audience, I just listened to a podcast that I've listened to the same episode. I listen to it every couple of years because I find it really interesting, and it's the restaurateur Dave Chang has a podcast where he interviews Jerry Saltz, the art critic from New York Magazine. And for some reason that particular episode I find very like creatively energizing. He has a lot of great quips. One of them is like, if you're gonna like make art, you just like need to be comfortable like dancing naked in public, and like and then you have to decide like how many people do you want to be dancing naked in public in front of, and then, he has a lot of great lines in that, about creativity, and he's also very inspiring because he became an art critic, I think, like maybe at 45, but up until then he was kind of like just hustling. He was driving trucks. He was like living a very gritty life, I guess, in like the Lower East Side or something. But there's a lot of great creativity inspo there.
So when you said your year of translation, are you reading these not in English?
No, no, no. I'm reading them I'm reading the English translations.
Okay, okay. I was like,
Yeah, but I'm not the only one. I think that literature and translation like had a big moment maybe
yeah,
like last summer. But
yeah,
yeah, I'm trying to make my year a little bit like, I think it's the right time to be like reading other cultures. It's like
yeah.
tough times right now. So yeah, so that I really recommend the Tokyo Suite. Um, was fantastic. And then my husband also, they're both really great. They're both like unhinged, unreliable narrators, which is
Cool.
my favorite kind of narrator.
Awesome. We'll have this in our show notes as well, as we always do. Anyone
Okay,
interested
awesome.
in checking them out?
I'll send you the link to the podcast, because
Oh,
it's like,
yes.
it must be old now because I've listened to it a bunch of times. Yeah.
That's great. Okay, I can go next. So yeah, so Grace, reading your book, like I said, it like brought up so many memories of just kind of like going through training. And so one thing it reminded me of was um, when I was kind of deciding on going to med school from undergrad, I started reading comics again. I read comics up until high school and then took a break through college. But then at the end of college, I rediscovered them again and I started reading a superhero comic called Starman, and it ended up becoming one of like the biggest inspirations for me going into medicine, which is crazy to say.
Oh my gosh.
But Starman it's a 1940s comic, like a DC comic,
Oh,
and
cool.
so it's like one of those golden age superhero comics of this scientist who invents this cosmic rod that allows him to fly and shoot energy blasts, whatever. So anyway, that was like a comic in the 40s, and then in the 90s there was like a Gen X reinterpretation of this character or this comic, and that was this. It came out like in the late 90s or mid 90s. It's also called Starman by DC
Oh,
Comics.
nice. Okay.
But in this story, it was Starman's son, basically. And
Okay.
basically the idea was that the 1940s Starman was like this celebrated, hero of his city. And then he had two sons, and the eldest son followed his footsteps and became the next Starman. And then the comic starts like in the first page that the eldest son is murdered by like the arch enemy. And so now this younger son has to decide if he's going to take up the mantle to like, become the next Starman. But then the younger son is like a slacker artist guy, not into superheroes at all, not interested in his dad's legacy, all this stuff. And so the comic is about this like reluctant hero who finds his own way of doing things, and doesn't wear the costume, like kind of uses you know uh his own experiences to find a new way of doing it. And for me, it was like same idea. I came from like a family of doctors, and I was studying art at the time, and at the time I was deciding if I really wanted to commit to medicine or not. And so this comic, strangely enough, was like a really a good way of me, as like a whatever 19 or 20-year old, to think about like, yeah, I could go into medicine, but like find my own way of doing it,
Oh,
and
I love that.
like
Yeah.
honored the legacy that like because my dad was like a oncologist. It was like very much like celebrated in his community, and so it was kind of like big shoes to fill. But it was like, I don't have to be that, but I also can find like a different way of doing it. And now, like looking back, 20 years after that, it's like I kind of have done that, and I feel like I
Yeah,
did find a
you
way of
are a
like
Starman.
making it work. But yeah, so anyway, that was a great comic. So then I started rereading it again because I was like, yeah, this is like, it was a really cool comic. So anyway, there's a whole omnibus. I actually got one of these in Toronto during a graphic medicine conference, but
Oh, cool.
you can buy the entire series in two giant volumes.
Oh, nice.
Um,
Oh my
but
God.
was also nice about this comic, unlike a lot of like superhero comics from like DC or Marvel, it had a beginning and an end. So like
Oh,
there's an end, and then the character like it ended in like
that
in
is
the
nice.
year
Yeah, I see
early
what you mean.
2000s, and they never, yeah. So then it had a very good like complete story arc. But anyway, Starman, just check it out. It was written by James Robinson and drawn by Tony Harris.
Oh, okay. That's cool.
Nice, nice. Okay, I will wrap us up. I've talked in this podcast about how I can't listen to any of my news podcasts anymore, which were like what I did as I walk around and walk the dog and do my chores in the house. I just need to have something else in my ears, and so I can't listen to those. So somehow last year I got really deep in on mystery novels, and I
Oh,
read all of Louise Penny's Three Pines mysteries, all
oh
20 of
wow.
them last year. Um, so then I've been like trying to like find other venues, and I'm into series, right? Like I want to know there's like if I really like that there's 20 of them, right? So I can
Yeah,
just
yeah.
completely immersed. So currently I'm in the Tana French mysteries. They're in Dublin, the Dublin murder series. You're nodding.
Oh, nice.
Are you familiar with this at all, or?
I know who Tana French is, but no, I have not read the murder
Yeah, so
mysteries.
the interesting thing is, and then I'm alternating like with these Irish kind of very much candy. I think I mentioned in the last episode, like charity shop detectives, like these three middle-aged women who like,
Cozy.
yeah, right. And that's a whole, I'm learning like that's a whole niche, right? There's the Thursday
Yeah.
Murder Club, but then there's like name any kind of group where people gather, and there's ones that they have a murder club, right? Like,
Yeah.
the book club murder club, the dog shop murder club, right?
Yeah.
That's like a whole thing, and a lot of them apparently are British, and so it's very interesting to go from the British ones to the Irish ones because the Irish ones just feel, at least the ones that I'm listening to, and then my other data point is like the John Banville mysteries, which are he's
Mm.
like a
Oh,
pathologist, right?
oh,
And so he's like coming from the morgue, and like they're dark and gritty, and everyone's like pretty miserable.
yeah.
And the town of French is a little bit lighter. They're cops, but they're generally pretty miserable. And so I've been alternating like the light ones with the like intense, but also like I love them all. So anyway, so that's what I'm listening. I just finished or I'm working on the third one, The Faithful Place. Well, the interesting thing that Tana French does is it's not like the Louise Penny. It was the same main investigator, right? And the John Banville are the same. This one, the main character alternates between different people that are all in the book, but the narrator is a different person in that group of people, and so it's kind of fascinating. So, like the last was from the perspective of a woman. The previous one and the current one are from a male perspective, and I'm always fascinated by how writers handle different genders than their own, and I'm very like I'm always listening carefully for that, and so far it's been really interesting, and I feel like I would think that they were interestingly fairly handled as different gender narrators. So anyway, that's my current deep dive in mysteries.
I like
Excellent.
in romance you can stay in the same like universe for quite a while. I'm not even discussing like not even romantasy, but just in like contemporary romance or historical romance. And I love that. That makes me feel like I'm reading Babysitter Club books like again when I can stay like in the, with the Bridgerton cousins and or that type of thing.
Right, right. There's a safety there, like especially this Three Pines mysteries, because this place just felt so like that you just fall in love with this place. And so
Home now. Yeah.
what's that?
It's home now.
Right, exactly. It's like, and I was living in Montreal in my head, or outside of Montreal in my head. And so my wife and I are actually traveling to Montreal. And so I was like, oh my God, we can go to the area like on the Vermont border where this was all set. And then I looked it up, and it turns out there really is a bookstore that is this like
Oh,
based on these books. And you can take tours of this town, and they're like $400 for a day tour. It's like a whole cottage industry
oh,
of
nice.
showing you the like place this was based on, which is kind of crazy. But anyway.
That's awesome. Yeah, I think this is almost like similar to like episodic comics where it's like you
Yeah.
get to know like this environment, you just want to keep living. I mean, although who
Yeah.
would want to live
Yeah.
in Gotham City, but still like the idea that you're like familiar with these characters and they're just
Yeah.
recurring. Yeah,
They're friends. Yeah.
Right,
exactly.
right,
Yeah.
right, right, right.
Well, that was great. Excellent choices. So, well, yeah, we'll have them all in the show notes. Grace, thanks again for joining us today. This was such a great conversation. Yeah, I'm looking forward to hearing a lot more people talking about your book as it's coming out and more people are reading it. And I once again, I think this is going to be one of those mainstays for like people in medical training. So I think it'll be in the pantheon of those that aspiring doctors and healthcare providers will read. And
Oh,
so,
okay.
yeah, I think
Yeah,
I think it will
I'll
be.
definitely be using it with my students, and I'll be curious their reactions. Yeah.
Oh, thanks, MK. Well, thank you both for having me. This was such a fun conversation, and it was nice to see you both before July.
Yeah, right. Looking forward to it.
Yeah.